Hello, everybody. We are so excited to be here. My name is Bené Watkins Chambers. I am the president and CEO of Crossroads Community Services out of Dallas, Texas, where we are strengthening families to build nutrition-stable communities, which is what we're going to talk about today. And I'm glad to be here with my friend and partner in this work, Whitney Strauss.
Thank
Tell
you
us
so
about
much.
yourself.
So I am representing the AdvoCare Foundation. I'm the executive director. I have been with the foundation since 2015, and our focus is on eradicating childhood obesity, including helping communities have healthy eating habits, which is why I am here today to talk about that.
Absolutely. Well, you know, what's interesting about Whitney is she is soon to add a few letters to the end of her name to get your doctorate. And your dissertation is on something that I think is very interesting, food sovereignty. We're hearing a lot of new terms around the issue of food insecurity, a lot of new narratives. Talk to me a little bit about why those narratives are important and the impact that they're going to make in addressing this issue of food insecurity in our communities.
Sure. For those of y'all that may not know, food sovereignty is solution-based. So it's looking at what communities are doing to own their entire food system. So it is fairly new in the food landscape, at least the last 20 or so years. And for me, the importance of the narrative is twofold. One, it is talking about community solutions to the issue of food insecurity in the communities that are impacted the most. But in addition, it's changing the narrative to talk about food as a human right, which is fairly new. So no longer a kind of social service or talking about it as a certain condition. It's talking about it as each of us as humans, it is our human right to have access to healthy food. So that really empowers us as a community to look at those solutions to resolve that.
Absolutely. And I think as you're doing that, you've had some interesting interactions on some urban farms. Tell us a little bit about that.
So that's actually the focus of my dissertation is urban agriculture. So purposely looking at the urban farms that are owned by the communities that they are based in, which is a little challenging to find, to be honest,
Right.
because 95% of farms are run by white men, which all due respect. But looking at community-led solutions, I wanted to find the farms that are actually based in the communities that they're served and run by people in that community. So yeah, it has been interesting so far. I'm right in the middle of my research and looking at Tucson, LA, Detroit, and Atlanta as my models for what I want to base my case studies on, and really the entire system that they have built to support really eradicating food inequity in their communities. So it's exciting. More to come.
And so I know one of the things we wanted to talk about today too is really as we're entering into some of the health studies around 2030 and the social determinants of health, you know, what is happening in the space of community organizations. So community organizations like Crossroads who are really, as you said, creating that space of human right, of the dignified experience of not just being given a box of food, but really getting the opportunity to shop for themselves, produce, healthy proteins, plant-based foods that we are able to provide to the people that we serve in the communities. But let's talk a little bit about the access to that. So one of the challenges in accessing those types of what once was maybe pantries, but now maybe considering community markets, is the fact that they are not always in the location where the people who need them the most are. So when you're looking at this, and you've been a part of Crossroads and knowing how we do this work, what are you finding is that part of what we want to do, revolutionizing that distribution of food directly to community members that is making a difference?
I think it is that market base that you're talking about, Bené. It is being intentional about looking at food mapping and the distribution. So looking at how healthy produce and the food that's given to you by the North Texas Food Bank, how that is coming to the communities that need it the most. So it's being really intentional about that, and involving the community in that solution as well. And when you talk about the social determinants of health, it's also making sure that there's a model, which I know that you're working on that right now at Redbird, that is looking at if someone is coming to a clinic, that there is also the access to food, because one of with social determinants of health, it's looking at that upstream of healthy food is a contributor to social determinants of health in addition to the environment that you live.
Exactly,
So,
yes. And so when we talk about what that model looks like, some of you may have heard about FoodRx programs. Medicaid and Medicare is now actually reimbursing for referrals and prescriptions for produce and food. And so Crossroads is looking to launch into that work by creating a nutrition pharmacy, a place where equally people will go to get their medications. Well, we know food is medicine. This is a new term, but the reality is food has always been medicine. And so now it's those health communities actually understanding that that social determinant is about access. And so putting those nutrition pharmacies right in the same space where those folks are going to the doctor. It's similarly to our pharmacies for medication. So really, how do we create the access? It's really about proximity, right? Because proximity, if I have to go too far, I'm probably not gonna go. Yeah?
correct, yeah. That's been research based. That's something that I've found in my research is, yeah, if you're creating more barriers,
No.
then you're not going to be able to have that access. So part of the community getting involved in that is to make sure that you are basing those solutions where people need it the most and not creating additional barriers that they are already experiencing. So that's why I love what Crossroads is doing, because y'all are definitely the thought leaders in making sure that that's happening.
Absolutely. So one of the main barriers when I'm often asked about get people accessing food that need it is transportation. So when you create another barrier that now I've gotten my transportation to the doctor, I now have another barrier to go and get the food. And then when I need to go back to the doctor, I'm not having that consistency of accessing the food when I'm in the place where it's being determined that I need it. But you had an interesting experience in the last few months. I was very jealous, by the way. You got to go to Tanzania and really experience there what you felt like was a solution. You came back and said they figured it out there. So what did they figure out?
Which I know people are going, really? Because in the scale, there's still considerable amount of famine going on in Africa, particularly in East Africa where I was. But I was able to have just a complete experience spending time with people in Tanzania. People ask me about the animals. So I spent half a day looking at animals. It was having this really profound experience with people there. And I was able to see their food systems. And what they've built, and I've since read more about it, is food resilience. So knowing that we are dealing with climate change, knowing that they're going to be dealing with famine, knowing that there's politics, economic circumstances with this, it is how are each family making sure that they are food resilient. So everywhere you go, from villages to in the city, and I was in Arusha for part of the time too, you are seeing that each family has built a whole system with their agriculture in their yard, but then they've also looked at alternatives to market-based solutions. So there's bartering again, or this side of the neighborhood is growing one thing and this side of the neighborhood is growing another thing, and they're trading and bartering. And when I was asking about food in Tanzania, one of the leaders that we were with just gave me a strange look, and he said, "We take care of each other here." Which I think we all can learn from that. They said there's plenty to go around. We take care of each other here. And from that really changed, was part of changing my perspective on bringing that experience back to our work here in the States and looking at those, again, community-led solutions with urban agriculture and the distribution and everything else, and what could we be doing differently, or at least have a different perspective about it.
Well, and when we think about community-led solutions, we also think about the fact that that means the community has to be involved and the solution has to be consistently involving them. And so one of the things that we do at Crossroads is really work with our partner organizations. We really listen to the folks who are coming in to receive food from us. What do they like? What do they not like? I think we also have to understand that just because someone is lower income doesn't mean they don't have or want choices. Right. Choice in my food is a human right as well, as is the ability to have culturally relevant food. So a lot of people will look at a community organization like a Crossroads or any of the others that you've seen today and say, well, why aren't you just focusing on this one thing? Because it's what that community needs. And let me tell you, I hear that frequently. And I say, really? So should I come and tell you what you need? And is that all you're going to want to eat? And so I think as we're thinking about what are the solutions, it's how are you bringing those community members in to the space? How are you asking them innovatively how they would solve the problem? So
on that note, I have a question for you.
Okay.
So you all probably, hopefully have read that the SNAP benefits have gone away. So in addition to rising food costs, I have been reading more about this is considered a hunger cliff. So we not only have those that have chronically experienced food insecurity, but now you have what I am calling the food vulnerable. So it's this whole other population of people that at any given time, any change in their situation, from inflation to rising food costs to their car breaks down or whatever, will put them in a place where they will need support for finding healthy food. So I'm curious how Crossroads is looking at that and finding those solutions.
So we really are focusing on building that nutrition stable community. So it is inclusive of multiple aspects. First and foremost, the community market. That's where we're giving that dignified experience to our community members who can't afford the grocery store, the opportunity to shop in a grocery store type experience. The second is school markets. Chef said it best. If the children aren't eating, they aren't learning. But one of the challenges is they can eat at school, but when they go home, they're missing the next meals till they get back. So can we get those markets in our schools where those children are able to shop for their families even, or with their families, in a place, again, proximity, that is proximal to where they are. Then we're looking at mobile markets. You have a lot of rural areas where you don't have access, where there's still a lot of stigma around the issue of accessing food at no cost to the family. So let's take it to them. And then it's the nutrition pharmacy. So we know that so much of our health outcomes are based on the food that we are eating, again, proximal to where they're going to the doctor. So it's not just one thing. It really has to be a full circle of access to food in all the places that I'm already in and the ones that I can't get to for whatever that reason is. You're going to actually bring it into my community. So that's the type of work that we're looking at, and that's the type of work that I think is really going to make the difference moving forward. But I want to go back to something that you talked about in the urban farms. One of the things you found in the urban farms as well was how that community was not just creating the food through the farming, but how they were creating work. Right. And how that ultimately also leads into access to food.
Sure. So I found there are really two distinct types of models for urban farms. It is the model of wanting to provide food access for with the goal of addressing food insecurity. The other model is more of an economic empowerment. So they create jobs. They create pathways for those that are formerly incarcerated. So I have seen that as an economic model as well that has lifted up that community. I think when we're looking at urban agriculture, it's important to understand that there are lots of subjective benefits to them. And that's a huge part of my research, is looking at who is benefiting from urban farms and how. and then how are they a part of that, into that whole system within these communities of providing healthy food access. So.
And you are in research, and Crossroads does a lot of research, but talk about why the research partnered with the community organization is changing the narrative both, but also the data. There's so much data, but what are we doing with the data that's coming out of the research, and why is it important to be partnered with these community organizations in doing that?
I think that's a great question. It is. My chair of my dissertation committee asked me, he said, how are you proving your impact? Are you sure that you're really providing the access to food, and are you really kind of proving it? So I think that's where data really helps, is because it's not only making your case in the community or to funders or whatever, but it's actually kind of continuing to question, are we really helping those that need our help? Are we really fulfilling our mission? So that's where I think the data-driven solutions are so critical, that we can continue to question that and to really work towards making sure that these efforts are really helping those that need it the most.
So, one other question that we hadn't previously talked about, but I'm going to ask anyway, is really, Whitney, you're coming at this as a woman, I'm a woman as well, but when we're looking at this, and we've heard a lot about the importance of women in this work today, what does the future look like on the research side for women to really be digging in to the research, to be controlling and not controlling, we don't want to control the research or the data, but really be in the space of leadership is what I would say, in the research that is fueling the information for the decisions that are being made for whether it's venture capitalists, whether it's community organizations. Where do you see that? I mean, with Women's Month, so let's talk about that for a second.
I think we've heard a lot of great things so far today about the women in food and the importance of women continuing to lead in this space. For me, the largest percentage of households that are impacted by food insecurity are women. They're single moms. So for me, it makes it personal, that I, as a mom, want to seek the solution for other women that are facing this challenge and to lift them up. But I'm also finding in communities that the solutions that are coming up in urban agriculture or others are women-led. So with that lens, it's just one more piece of empowering women to be a part of this bigger solution and get into the research and get into the data to show that and then share it amongst communities too.
Great, thank you for that. So as we head to our wrap up and we think about the future of food, what for you do you see as the future of food in the space of access, particularly community access for those who need it the most?
I think we really need to look at all community-led solutions, but also be really open-minded to different solutions. So I know you've heard this a lot. If we had $1 for every time we've heard it, we'd be well off. But then why don't they just put a grocery store in that neighborhood? But I think those market-based solutions, that's not really going to be enough. That we need to look at alternatives to that. We need tiered grocery stores where you can either go shop for free or you shop based on your income. And how retail is involved in redistributing that produce. I know that's a big focus for Kroger, which I'm excited to hear from them today. I think you need to involve, and I've seen this, involving the community and talking about what do they need, what do they want, and looking at that resource mapping of what's already existing there, and then investing in those solutions.
Absolutely, I love that tiered approach because really, when we think about it, Crossroads does huge partnership with one of our local institutions, UT Southwestern, and people are always saying, how do the two of you, a community organization and a major institution of learning, do all of this amazing research that is literally revolutionizing the way pantries and community markets are distributing food? And I say, because we choose to. We choose to. So one of the things that people are always saying to me as well about the grocery store, I'm like, that's great, let's bring a grocery store. Let's also bring a grocery store that has a community market attached to it, so that we can meet the needs of the low-income families that can't afford the grocery store. They can use their SNAP benefits in the grocery store. But we're forgetting that there's a middle group. There's a middle group that they can afford some things in the grocery store, but not everything. And so how can retailers and community organizations partner in the exact same space, again, proximity, and allow that whole continuum of community members access to the food that they need and the right that they have to have food? If we can do it as a small nonprofit organization and a very large institution, it can be done. And when I think about the future of food, that's what it is. It is the decision for big organizations, small organizations, community-led efforts, and large retail partners to choose that it's not always easy and there are challenges, but that we are going to create a solution for this that is about access for everyone to have the right to food.
I think that's an important note to end on too, because we already have the tools to solve this problem. We have more than enough food in the United States to feed everyone plus some. And I know climate change has been talked about, and absolutely this is a huge part of it, is how it's being produced, how it's being distributed, and then the amount of waste. So if we have the tools already, it is, to me, going to that in the community, talking even by neighborhood about what would work the best here and making it culturally relevant to that community, looking at their distribution models, looking at those locally led solutions. But we have the tools already. So I think for the future of food, it is that accessibility, that proximity, but also us connecting and talking to each other, which is a huge part of what we're doing today, to look at connecting the dots and what would work and thinking outside the box on different kinds of markets, different kinds of distribution, what's already in that community that we can provide healthy access to food, because we have it, we have all the tools.
I was recently at an event where the speaker said that we could fill, and if you've ever, that we know people are listening and are here from all over the world, but Texas Stadium, everybody knows the Dallas Cowboys, the AT&T Stadium out there, they can fill it 8 times with the amount of food that we waste, And that's massive amount of food that is just thrown away every day. And so when we think about how, again, we partner together to meet in the middle. Kroger is one of our great partners. We actually receive reclamated food from them that we're able to redistribute back out in the community. It's all shelf stable, but there's an opportunity for that to be produce as well. So again, we know those large institutions and community organizations can work together. So I want to leave you, and I'll ask Whitney to do the same in our last minute, with what you can do. There are 3 things. Who is your local organization that you need to be spending some time with and trying to understand how they are using community-led solutions and how you can partner with them? And then who are our business owners, investors, who can invest in those partnerships? Because it's important. We can't assume that the nonprofit can do it because they don't have the money. I promise we don't. And we shouldn't assume that it's all the responsibility of the retailers either. But it's a collective effort and a collaborative effort to come together and find the solution at the table with all of us, and particularly because we've decided that food is a human right. Whitney?
I think I would have you all do a call to action to ask this question in your own communities. I know Austin has a great coalition already that is looking at their food system that I'm excited to hear from today. So shout out to Austin for being a part of the solution. But ask in your own cities, is there a coalition? Is there a group that is made up of all of the entities that are involved in addressing food inequity, from hospital systems to education? They should all be at the table. And in addition to food service organizations, in addition to retailers. So go back to your communities and ask that question. Does that exist? Because if it does, that means that they've started the conversation, which is important to connect the dots to really resolve this issue. And if it doesn't, advocate for that in your own community.
Yep.
Because if they're not talking to each other, then that solution may be missing.
Absolutely.
So really talk to your elected officials, talk to your community leaders. Does that exist in your community? If it doesn't, let's do
You
it.
get to start it. All right. Well, thank you all very much for your time today.